So we frequently hear questions from patients asking, what is all-on-4 or teeth in a day? And that's an excellent question. And it's the ability to replace your teeth with new teeth that are permanently fixed in the mouth that rest on implants and not on the gums. Unlike what you might hear on television, teeth in a day isn't necessarily done in a single day. It is true that when the time comes, you will show up in the morning and then you'll leave that afternoon and you will have new teeth, but there's a whole lot of steps that are involved to get you to that point. And it usually takes several weeks to prepare somebody for surgery. And in that, we have to collect all that proper data, ensure that we have your teeth made, work with the oral surgeon as we plan this comprehensive and complicated procedure. The all-on-4 or teeth in a day is simply a way to replace your teeth that rest on dental implants. This provides you the best comfort and function and stability of your teeth, and thereby giving you the opportunity to eat the foods that you want to eat again. So we're often asked, how long does teeth in a day take? And what are the steps to get there? And if we wanted to, we could break it down into 5 basic steps. Step 1 being the most important. And this step includes meeting the patient, understanding what their history is, where they've come from dentally, what are their desires. And after we do that, we'll collect some data. Do a thorough, comprehensive examination and develop a treatment plan. And step 2 would be to get over to meet our oral surgery team, to talk to them and to ensure that they're healthy to go through a procedure like this, and ensuring that the implants are going to be not only where I want them for the teeth, but also from a biological standpoint, what's going to be best for the surgeon. So step 3 is the actual surgery day, and that is the appointment where the oral surgeon and us, either myself or Dr. Gurney, are at the surgery and the implants are placed and we actually deliver your prototype teeth. And after that surgery is over, you go home and sleep. Step 4 is the healing phase. And we have protocols in place that help you through that whole process that can last 3 to 4 months. And step 5 is the restorative phase, or the final phase. The phase that most patients are so excited to get to is getting your new teeth. The teeth that you've been waiting for the last 4 to 6 months.